Welcome to today's video. One of the most common challenges breastfeeding moms face is latching issues. A good latch is the foundation for a comfortable and successful breastfeeding journey. Today, I'll share the most common latch problems and easy solutions to help you and your baby feed with confidence. Stick around for a bonus tip at the end on how to maintain a great latch once you've mastered it. If you find this video helpful, subscribe, and share it with other moms who might need support. A shallow latch can cause discomfort for you and frustration for your baby. Here's how to fix it. Reposition baby. Bring your baby's nose to your nipple so they tilt their head back and open wide before latching. Support your breast. Use your hand to compress your breast, creating a sandwich that's easier for your baby to latch onto. Break the latch. If it hurts, break the latch gently by inserting your finger into the corner of their mouth and try again. Pro tip: watch for your baby's lips flanging out. This is a sign of a deep latch. Let me know in the comments how this works for you. Sometimes, your baby may refuse to latch altogether. Here's what you can do: skin-to-skin contact. Hold your baby close with skin-to-skin contact to calm them and encourage feeding instincts. Express milk first. Hand express or pump a little milk to soften the nipple and entice your baby with the scent and taste. Try a different position. Experiment with positions like the football hold or side lying to see what's most comfortable for your baby. Pro tip: stay patient and calm. Babies can sense stress. Share in the comments which techniques have worked for you. Pain while breastfeeding is a sign something isn't right. Here's how to troubleshoot. Check alignment. Your baby's body should be in a straight line with their ear, shoulder, and hip aligned. Relieve engorgement. If your breasts are too full, hand express or pump before feeding to make latching easier. Use nipple cream. Lanolin or coconut oil can soothe cracked or sore nipples. Pro tip: if pain persists, consult a lactation consultant. They can identify and address deeper issues. Let me know in the comments if this advice helps ease your discomfort. Clicking or popping sounds during feeding may indicate your baby is losing suction. Here's how to solve it. Reevaluate positioning. Ensure your baby is latched deeply with their chin pressed into your breast. Check for tongue tie. This condition can make it hard for babies to maintain suction. Ask your pediatrician or a lactation consultant for advice. Burp frequently. Air swallowing can happen if the latch is weak, so burp your baby often during and after feeds. Pro tip: a lactation consultant can help assess tongue tie or other physical issues. Share in the comments if you've encountered this challenge. As promised, here's your bonus tip. Maintain a good latch by watching for hunger cues and feeding your baby before they become fussy. This keeps both you and your baby relaxed during feeds. Thank you for watching this video on breastfeeding latch issues. If you found it helpful, subscribe, and share it with other moms who might need these tips. What's your biggest challenge or success story with breastfeeding? Share it in the comments. I'd love to feature your experiences in a future video. You're doing an amazing job, and I'll see you in the next one. Happy feeding!